on this episode of A Tale of Two Hygienists.
Scaling, it's too much of a specialty, and it is something that takes a long time to really get, quote unquote, the feel for, truly. And it's something that can not be left in the hands of someone that is trained by a dentist, and that I feel as though the patients would never understand or know the difference. I mean, maybe a few, but as long as they leave their appointment feeling minty, their gum disease progression is going to be put at risk by someone that doesn't know or recognize perio. I do understand that not enough of our communities are getting to see a dental hygienist, especially now. And I am very defensive of what it takes to be a good dental hygienist, and that those safeguards have been put in place for a reason. We're not churning out enough of us every year, but I also understand this is a really, really, really specialized occupation.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 475. I'm your host, Andrew Johnson, and thank you so much for being with us today. We have a great episode for you. It's a little pros and cons, a little not controversial. It's not really controversial. I think all hygienists are feeling the same way, no matter what state you are in. But the episode with Erika Flateau today is about the dental assistants taking over scaling responsibilities. And I try and play I thought I did a really good job of acting, but I try and play the pro, like, yes, we should let dental assistants do this. And she plays the con. No dental assistants should not be licensed to do this, or in some states, not even licensed, just allowed to do it. And so that is, so we tried to, tackle all the different angles that we could think of for that one. But it was really good. I think the bigger picture here is that we all need to work together. We all need to band together. We need to write our legislators. We need to do all of the things that we talk about that we're supposed to be doing as hygienists, right? We need to band with the advocacy groups. And quite frankly, we need to have better conversations with our doctors. When I talk to the dentists, most dentists don't actually want this either. There's a very small group of dental professionals who are bitter and angry and are lashing out. And that's what's driving all of this conversation. And because they have the ear of legislators, they're the ones that are making this kind of change. And so we need to partner with our doctors, get our doctors to talk some sense into their fellow doctors who are making these pushes. Because again, I know dental assistants don't really want this, and I know that dentists don't really want this on the whole. Anyways, so it was a really good episode. Thank you to Erika Flateau for being on today. And that's it for me. I'm heading to Chicago Midwinter this morning. So if you're around, be sure to shoot me a quick message and maybe we can meet up. But that's it. On to the episode.
A tale of two hygienists.
Listeners, welcome to the interview portion of the podcast, joined today by Erika Flateau. Erika, thank you for being here.
Andrew, thank you so much for having me. It's so great to be back with the podcast.
My voice just dropped out when I was trying to say your name, and I'm not even trying to say that again. But
Okay.
but I'm glad that you're back. Listeners, I think this conversation, what I like to think of this is when we're at like the dental conferences and we're just have our buddies, around, we're talking about the woes of dental hygiene and the profession, all of that. And then, we start talking about different topics. I want that to be the feel for this type of conversation, because Erika and I were talking offline a few days ago about just some stuff that's going on in Washington State.
Yeah.
And then the conversation evolved. And we have, I think, similar desires for improvement and for protecting the public, for protecting the profession, but we have definitely different ways of maybe looking at that and what does that actually mean. And so if you're okay with it, I want to find the spot in our messaging where I think that we started getting off track, and then we can kind of jump into the conversation. I pick it up again. Is that okay?
That's totally fine. I also have something to ask you, if it's okay. So
Always.
that this, in the spirit of a true debate, even if I start to kind of see Andrew's point of view, I'm kind of committed today to just staying with my kind of assignment for this debate in my mind of what I want to relay. And because Andrew has incredible power of persuasion, and he is such a and he will make a lot of sense, and I'll go, oh yeah, and that is where we want to come together on this, of course.
Yeah.
But if you notice me trying to stick to the narrative that I'm bringing to this conversation, I'm doing it on purpose because I want to
Well,
present both sides. Yeah.
and it goes both ways. Like
Yeah.
I'll make the same promise to you. Like I'll try and stick to my side as much as I can with this debate format, and just listeners, don't hold it against either one of us if you don't agree with us. This is
Definitely.
again for the spirit of the debate of this thing. Okay, so let me
Okay.
find that spot.
Okay.
And then as background while I'm looking for this spot, basically what is happening in Washington State and is happening in many states across the U.S. is this dental assisting scaling bill saying, hey, we don't have enough hygienists, then so we want to have our dental assistants start scaling, and we just want to, on the job training, and there's all sorts of stipulations in the various states that they're putting into these bills. And so the conversation that we had was kind of like a jumping off point there, where you had said, oh, hopefully that's right. So you say, and patients would be at such risk. Even my easy profies need definitive hand scaling under the contacts. It's horrifying to think I'm an assistant doing my job.
Right.
And then my perspective, I said, I don't mind the idea of supra scaling, but I just don't think it'll stay there. It's opening the door, but just like, well, actually, I'm very bad at typing apparently, but I said, but just with restorative, I think there is a pathway that can be done, and that scaling could be like a year-long course on weekends with tests and college-level credits awarded that they need to pass a board exam, again, just like we do for restorative. So going back real quick, also context for the listeners on this, Washington State has their version of an FDA, but it truly is placing definitive restoration. So you can place the amalgams and the composites, and you are still an assistant. But the stipulation with that one is that they do have to pass the board exam, just like we have to pass a restorative board exam.
Yes.
So it's very similar in that way, where we're trying to. Washington does a very good job of like really making sure that the elevating the requirements for entry. Okay, so my position is, I think that it's not a public safety issue to have assistant scaling.
And my, especially according to this new House bill in Washington, which people can read the proposal, my stance is that scaling is it's too much of a specialty, and it is something that takes a long time to really get, quote unquote, the feel for, truly. And it's something that can not be left in the hands of someone that is trained by a dentist, and that I feel as though the patients would never understand or know the difference. I mean, maybe a few, but as long as they leave their appointment feeling minty, their gum disease progression is going to be put at risk by someone that doesn't know or recognize perio.
So let's get down to maybe the root of your concern. So a dentist would end up having to do the perio charting. And so far we're talking about supra. Are you also talking about subgingival scaling?
Well, the problem is, I guess I should back up. When I was talking to you the other day, I had just had a 19-year-old in my chair, quote unquote, easy patient. She came in and looks beautiful, hardly even any supra. Someone could flick that off, polish her teeth, and say, you're good to go. And then, she'd been away at college. And once I got underneath the gum line slightly and under those contacts, it's nothing I could see with my eyes. It's what I could feel with my instruments. And there was a lot of calculus under there. And then we would get this person back and wonder, why are their gums so inflamed? Even some children, assistants see children a lot in our state. But sometimes they're like, ooh, hygienist, maybe you should come in because we're just not getting this inflammation under control. And sure enough, there'll be calculus under the gingiva. So I was thinking to myself, who is determining who is a healthy patient and who is not? And would this 19-year-old be set up for a life of periodontal disease coming on far earlier than, some of us are, all of us are going to experience a little bit, as long as, we're going to live as all these years that we want to live now. But I thought, who is determining if this is an easy, healthy patient? Why? Because we just can't see any supra, or we can see a little supra. And with the years of tactile sensitivity and definitive hand scaling, there's really very few people that don't need that type of scaling and just need the supra knocked off. And so this goes so deep, Andrew, because we know the situation we've all created. We know hygienists' part in it and creating this battleground. And also we understand that patients aren't getting access to care because we lost, 10% of our workforce? And now hygienists, some of them, are holding doctors over a barrel, and the doctors are mad. So that's a whole nother show, that we could talk about. So we understand what's gotten us in this predicament. So they're looking for someone that's going to take care of their hygiene patients. But the bottom line for me is who is determining who is a healthy patient? The dentist? And this House bill doesn't
I mean,
even...
currently,
Yeah.
who does it? Who is responsible for that diagnosis?
Well, because we have to co-diagnose, it is ultimately up to the hygienist and the doctor together. But we all know that the hygienist...
Ultimately, it's the dentist, is what you actually mean to say. I know
Yeah.
you want to really push
Yeah.
this, that the hygienist is co-diagnosing, but ultimately, no, it's not the hygienist. It really is the dentist. In reality,
Yes, but
best
legally...
practices, what we do is different than what the legality of it is.
Mhm.
And therefore, it is not, in my opinion, absurd to expect a dentist to be like, hey, this is a healthy prophy appointment. If they
Mhm.
know how to perio chart and they do all these things, they go through school, they are educated in perio. And again, I think I want to stick with the argument of not doing like perio appointments with an assistant,
Mhm.
because I think most of the bills are supragingival scaling, which is not the same as a prophy. I think we all should all know that too.
Mhm.
But I think I think the dentist should be able to say, hey, this is easy enough, gentle enough, fine enough for this person who doesn't have to have the super skills. Or I know lots of really crappy hygienists that miss calculus all the time too.
And that's a separate
So
issue that you're 100%
that's
correct.
not, like,
And they shouldn't have
they should be
passed
able to say
boards
with
or...
their with their skill set, or they shouldn't have passed the schools either, but whatever.
Correct.
That's all.
Mhm.
So that's something that I think is not a problem. We should be able to assess it and hand it off, no problem. Something like scaling, especially supra, when you're not looking at like root morphology, is something that should be very simple to do. I mean, if you
Mhm.
ever sharpened a knife or done any other sort of like skill outside of dentistry, these things are learnable. It just takes a little bit of time to learn angles and angulation, fit, the names of things. It's not, I wouldn't think
Mhm.
that'd be all that hard to do.
Well, I I understand what you're saying, and I know it took me a long time to become a hygienist, but that is because I went to a very particularly competitive school. It was very difficult to get into. And they're only still turning out 20 students a year, which I also understand is because we have to have a student to teacher ratio, and there's reasons for that. I understand that we have to pass these regional and national boards because that third party... By the way, I listened to your episode on that. The third party is important still, even though we have some schools out there that are every year turning out fantastic students. That unbiased opinion about who's ready to be released on the public, I think, is important. And you're right, no system's ever going to be perfect. There's going to be people that are graduating and passing boards that shouldn't be treating patients. I suppose that's true in any medical field. You can kind of tell sometimes when you go to the doctor and you're like, did you graduate in the bottom of your class? Because I think I know more than you do. But anyways, so I think that maybe... Well, the way the bill's written right now, it's like a dentist could train an assistant on the job, and then when he or she feels as though this person's responsible and capable enough, then they can go ahead and start seeing patients that are quote unquote healthy. That's asinine. There is no way that, in all respect to our doctors and everything that they bring that I don't know how to do, and they are specialists in. We are specialists in our field, and there's no way that the average general dentist out there should be determining who is ready to be a hygienist and who is not, based on, okay, you've been here 3 or 4 months, looks good, you're getting everything off when I come in to check. Okay, great. I think that the patients won't know the difference. And I think the patients would be put at risk by someone that does not know how to recognize perio.
But again, we're not asking them to do perio procedures. We're asking them for super scaling and or healthy patient appointments.
On
This has nothing to do with
somebody
perio.
that could have perio though, and they won't. And there's just such a
But why isn't the doctor catching it then?
And that's our conversation a couple, minutes ago was about, well, who's ultimately recognizing and diagnosing it? I'm sorry, the hygienists are. I know that we can't legally do that, and we have to always confirm with our doctors. But in my experience, and the listeners can comment on this, I feel as though I'm finding the perio and just informing my doctor, and they're confirming. They're leaving that up to me. They know we're the specialists in it, and they're trusting us to handle that whole entire foundation that they're putting restorative treatment on top of. And I think it's a fantastic system. But the issue of there not being enough of us is something I can't stick my head in the sand about. And I think it's just going to go away. And I have to also be cognizant of the fact that hygienists have helped create this feud and this situation where doctors are angry and they want their patients seen. I don't know.
Okay, let's roll this back just a little bit, because I think we're gonna keep getting off onto different tangents.
Sure.
So here's the thing. So new patient walks in the door.
Okay.
Okay. I, Andrew, the dentist, now have a scaling assistant for healthy patients, and I also have a hygienist, right? The new patient comes back into the doctor's chair for their new patient appointment. At what time do I need, as a dentist, the hygienist to co-diagnose with me as I'm telling them what chair they're going to be going to?
Yeah. It works about half the time. The doctors will probe, look around, check the x-rays, say, oh, this looks pretty good. Or, oh, you're going to need 4 quadrants. In my experience, they're not really skilled at assessing this. So there have been doctors in my life that have said, hey, can you come in and do a hygiene assessment? Can you probe? I don't probe like you. I know I don't. And I don't do their job. But something that you do day in and day out is obviously something we'll become specialists at. So is there ideal?
So in that case, though,
reality.
So in that case, again, I'm the doctor. I'm feeling like, hey, I'm calling my hygienist to come over, because I do still have a hygienist on staff.
Yeah.
Hey, will you come do the perio chart? Give me your assessment, blah, blah, blah. Okay. Now you and the doctor are both saying, hey, this is a pretty easy patient. At what point then I can't just be like, yank, stick that one patient right over there, just so that we can have you live up to the highest of your scope and skill, which is doing perio. And then we have someone else doing something that's really gentle and easy and won't have an outcome that might be adverse.
I like that idea. I will be honest with you. I even came up with the self.
Stand your side. Stand your side.
Well, sorry.
My side.
No, because this was one idea I came up with that it was okay. I'm going to debate you on that, Andrew. No, there is no proofy that can be done by somebody except a hygienist. The assessment was done by a doctor and a hygienist, and now is sent over to this person that can handle an easy profi. But my stance at the beginning of this podcast was that there were no easy profis. But the scenario you set up, a hygienist went in and assessed this person. So it's not the doctor assessing. That was really my bottom line. So say you have a self-checkout situation at the grocery store. You got all these dingling customers ringing up their own groceries, right? But you've got one, and not to say assistants are dinglings, but I'm a dingling when I'm ringing up my own groceries, I swear. I always mess it up and they have to come help me. But the one person that's standing up there at the front is a grocery checkout specialist. And they're observing all these people and going around when they're just not sure, or they need help, or they need someone to approve that they can see this patient, or this customer can ring up their own groceries. If a hygienist was required to be on staff that has passed what we all say are requirements to be a good hygienist, graduating and passing boards and getting that third party okay that you can take care of people, I could see something like that, where that person is assessing the people that are giving access to care. Because like I said earlier, I can't stick my head in the sand, and we have to deal with it in some way. But having dentists on the job train assistants to take care of healthy patients, I really believe that they their motivation is monetary, which doesn't make them that's a moral hazard. And the hygienist that is on staff assessing wouldn't have that business owner conflict of interest. So a dentist assessing who a dental assistant or enhanced dental assistant can see, to me, is too much of a conflict of interest. And there has to be a trained hygienist somewhere in this mix helping these patients make sure that they're getting proper care.
I know you don't mean it this way, but what it sounds like you're saying is that a dentist isn't qualified and neither is the assistant to do any of these things, and only hygienists are the only people qualified to do this. And I think that's a slippery slope, because I think that you're taking your feelings about how good you are as a hygienist and placing that amongst the whole entire profession, where I would say that you're actually more of an outlier, having not actually seen your clinical skills myself, but just, we've talked enough that, I can kind of feel like you know what you're talking about. I've seen a large majority of hygienists that have no idea what they're doing still, and also don't have the conversations with the patients about home care and all the things that they need to be doing, that they just go in for monetary reasons. They clock in, they scrape a tooth because that's what they're told to do, and then they're done. And then they don't think anything else. They just go back and they're done. So for me, I think my argument's less about like the profession and the title and the things. It's about the capability of a human being. And I think that just like new grad baby dentists coming out, how they are slow and they kind of suck at what they do, but no one ever holds them responsible or accountable for the mistakes that they make. It's just part of the learning curve. I think that there should be the ability to have a pathway for a type, like a subset like this. When you have your feelings about it, you're going to the worst case scenarios, where I'm like, well, what's the norm and what's maybe the best case scenario, and how can we actually make it happen rather than just shutting the door on it. So I just feel like
you're starting to make too much sense for me, so I'm going to try to stick to my guns here.
Okay,
and you're right. There's a lot of emotion involved. My own personal story, I probably need to take that out of it because of what I've had to do to be trusted with taking care of patients in this capacity. It was a lot, and it was rigorous. It was a big commitment. So that's the emotional piece. A lot of doctors, even though they pass a perio board, they will say to you, I don't like taking care of hygiene patients. I am not qualified to do this. I passed the board, but this is really, you guys are really the specialists in this. And so that's what I keep coming back to, is even though they can legally do it, they know they're not good at it. They know they're not good at assessing it. I've had a doctor say to me, I'll go, oh gosh, there's calculus so far down in this root. I think I might even have to refer. I'm going to go in there and try and see if I can remove it. And if not, we'll refer this to the periodontist, and they're going to have to open that tissue up and take care of this tooth. And they'll say, oh, what are you going to do? You're going to shove that Cavitron down there? And I'm like, oh no, this is going to take a little bit of, some really extended scalers and some real fine hand scaling and and I even find myself sometimes when I'm removing a piece of calculus that I cannot see and I can only feel, even kind of looking away, because part of that feeling of that root morphology, like you were saying, and I understand that's not what these people would be doing. I'm just saying the specialty is getting in almost a guise of, we need to get patients access of care. I feel like the specialty of this is getting kind of disrespected, and I know that's an emotional response, but this is not easy work. And as long as it's getting recognized properly and the person truly does not need anything that requires definitive hand scaling, then okay, fine, they can bust off supra and polish, and okay, they can, but the doctors want to submit a prophy code to the insurance. And let's not kid ourselves. They're going to be submitting the same codes that they submit when they're paying a hygienist. And that is going to be like, for a lot of them, not all of them, a lot of doctors are going to be like, no, we only employ hygienists. We have the best for our patients. We're not going to compromise. But some of them are going to be like, woohoo, party time. Let's do cartwheels, because now we can submit a 110 and a 120 and a 1206 and a 0274. And I didn't have to be a hygienist, all day long. I'll do this all day long and twice on Sunday. So I'm just thinking, that is a conflict of interest. And so if there's some safeguards in place, then yeah, as a hygienist, I have to recognize, and coming to the other side of the aisle of the debate here, I have to recognize that we got to do something.
All right. So let's put the debates thing aside
Okay.
so we can really talk about this issue a little bit more. This is the dumbest bill thing I've ever heard. I think that assistant scaling really is the stupidest thing ever. And not because they can't do it, or not that because they're not qualified. I think that is some bullcrap language that hygienists should never say,
Mhm.
because we've all been through a journey, and if they went through the
Mhm.
same journey that we've been through, then they can probably do it too. Like, there is a pathway. People are capable of doing things, and I think that's where the message gets lost when people are talking about this.
Mhm.
But on the face of it, the bill is stupid because it's not really going to. One, assistants don't wanna do this.
Right.
"Oh, I'm sorry, you're gonna make me do one more thing that I'm already doing 1,000 things, and I don't get really much of a pay bump. I might
Right.
get $1 more an hour if I'm a scaling assistant or
Mhm.
whatever."
Right.
That's just ridiculous.
I agree.
Um, and so, like, when we're looking at this access to care problem, this fixes 0 things. The other thing too is, like, dentists are creatures of habit generally, and I
Mhm.
think that they like the system. They don't like paying the people, especially if they're business owners, but I think especially associates, there's a ton of associate doctors out there who are not responsible for payroll, not responsible for paying the hygienist.
Mhm.
They like the system that's in place where, hey, this patient goes here for that, they go here for that, they see me for this, and then we all work together. We're a team. We do all the stuff.
Yep.
I don't think that there's gonna be an overwhelming number of them who are gonna be like, "Hey, you know what? Let's change this whole, like, paradigm
Mm.
just for funsies." And then also, where are they gonna get all these assistants? Because there's a short of assistants too. And so
Correct.
really, this thing that we keep talking about over and over again, it's like you're, robbing Peter to pay Paul. It's like, okay, well, then you're gonna screw yourself over.
Mhm.
You won't have enough assistants to do the big case restorative work that's gonna make you your millions of dollars,
Mhm.
because you want a few pennies on this pro fee instead. Like, that's what you want.
So even if we
Like,
have a
this is all
pathway,
stupid.
there aren't the people, is what you're saying.
And, if there are the people, it's I mean, not to put a number out, like 1 out of 100 assistants might wanna do it.
Mhm.
Like, no one wants to do this,
Yeah.
and it's like, so my thing is like, okay, well, if it's gonna get passed just because the ADA or the WDA or whatever the thing, this acronym is, in Washington wants it passed, they'll get it passed. It is important to put up the guardrails, just like they did for the restorative when they
Mhm.
let assistants do restorative. Our
Mhm.
AFTAs, and I think I told you this in our chat, but I didn't say it on this, I don't think. So, I've been grading restorative exams for, I don't know, 5 years, 7 years, I can't remember how many years it's been. And, one of the cool things is that they'll mix in some FDAs when we're in Washington, and we won't really know who they are, right? They all just kinda come and whatever. One of these times, though, we did get, because they do come in batches, so I don't know if it's gonna be the batch from, like, Washington, or if it's gonna be the batch from Pima, or the batch from, the FDAs or whatever, but, they come in waves. And so we're all in the back room, we're grading these mannequins,
Mhm.
and there was some really beautiful work that came through, and then all of a sudden there was a group that was just terrible. Just
And
the
they shall
worst. I
remain
mean,
nameless.
and they all failed,
Yeah.
and come to find out, it wasn't the Washington people, it was a different state that had
Mhm.
sent their stuff, and it wasn't all of them, I think maybe 2 of them might have passed, but it was a joke. But then
Mhm.
I look what okay, well, I also know that our Washington APTAs were mixed into this group, and they probably all passed because I didn't see something else like that, like a train wreck like that
Right.
in the other batches. So my whole thing is, like, people can elevate.
Yeah.
Washington did a good job of safeguarding and putting the rails on the side to keep everything in line, to make
Mhm.
sure that they were to the top part of that scale, not like a race to the bottom. And I think that if this is gonna get passed, then what the Washington State Dental Hygiene Association says should really be like, "Okay, well, if you guys really push through, let us help you craft what it
Sure.
looks like."
Yeah, and, you're correct too, because you said a lot of people don't wanna rock the system, and I didn't think of it that way because I have worked with EFTAs and they're wonderful, but they're not in every office. The doctors aren't like all of a sudden, "Ooh, wow, I can see 4 patients at once, and all I have to do is prep," and, you know, they really are not wanting, they are creatures of habit, you're correct, because 'cause they're all not
Mhm.
wanting to employ EFTAs. So they probably all won't want to employ a dental assistant that's going to do hygiene, or take away from their dental assistant that they need in their restorative
They're
room.
not doing hygiene though. You gotta be careful with that narrative. They're not doing hygiene. They're doing super scaling.
That's the slippery slope you mentioned. I'm
Hygiene
afraid
is
that's
so
where it will turn
completely
into.
different. Well, yeah, sure, of
Yeah.
course. But I think, when we look at a scope of what a hygienist can do, per state, this isn't a hygiene appointment at all. I wouldn't even call it a hygiene appointment. It is a supra scaling appointment. That's all it is,
Mhm.
really. A super
And that
scaling,
would
maybe even
be
polishing appointment.
what it should stay at, but it will turn into, if a dentist wants to employ an assistant instead of a hygienist, his front desk person will be booking her a room, of appointments all day, and I believe patients will think that they're having a hygiene appointment. I think that will be the language used. So,
I mean, it could be,
yeah.
but we also don't know what that means. Like, I'm
Mhm.
assuming a lot of different things.
Right.
I really don't think I can't imagine a scenario when even a super scaling assistant is seeing the patient front to back, because we also have, at least annually, they have to have a perio chart done. Who's gonna do that? Right? Like, so it's not like they can just load up the whole entire day of their schedule with these super scaling
Well,
appointments.
it's said in this particular dumb bill that this dental assistant expanded person can probe it as long as they've been probed before by the doctor or a hygienist. So you can find that in anybody's chart, and so that's another run around on away from them assessing perio. And I know that I have 7 or 8 patients in a day, and I've got a 37-year-old, I've got a 14-year-old, I've got a 78-year-old, and someone will say to me, "Oh, that person's young, they're gonna be easy." Oh, no, I've had much younger people be just as difficult as a 78-year-old that flosses after every single thing that they eat. So, it's really, really difficult to determine who to put in that schedule, and there are surprises too. You can look in, as even as a seasoned hygienist, look in someone's mouth and think, "Oh, this isn't gonna be too bad." I have learned to not say that. "Oh, you're doing great," and then you get up under there and you're like, "Oh, man, I wish I hadn't said that, because now this is really difficult today." And
And
so,
they just saw a hygienist last year, and they still have all this stuff because the hygienist missed all that because the hygienist wasn't that good.
and you and I could talk a half an hour about that, because that pisses me off. I'm sorry. That
That's
makes
right,
me
you'd say
very
this.
upset, and,
Huh.
and that gives a bad name to hygienists. And so,
Does.
yeah, and so that is, again, a whole 'nother conversation, and I am not okay with that at all, and, that's a real shame, because perio has no, symptoms. It doesn't let a patient know there's anything wrong, and when it goes undiagnosed and untreated and the person is believing and trusting you that you're taking care of them, it's despicable. So and if you don't know and you just need more training, fine. But if you know what you're doing and you're still choosing to mistreat patients, it's a tough one, and just for the paycheck. So, again, whole other conversation there, Andrew. But I do understand that not enough of our communities are getting to see a dental hygienist, especially now. And I am very defensive of what it takes to be a good dental hygienist, and that those safeguards have been put in place for a reason. We're not churning out enough of us every year, but I also understand this is a really, really, really specialized occupation. So I get that as well. I take a lot of pride in that. But I I I can see the other side. And I do appreciate that you are trying to create a pathway that puts safeguards in for patients and is also reasonable, as opposed to this ridiculousness we're seeing down in Olympia.
Amen. Amen to that. I can't believe some of these people who write these bills and propose them, they have 0 awareness and 0 perspective. It's crazy pants.
Mhm.
Well, I appreciate you jumping on and talking about this. I'm sure we could talk about this for
Oh, yeah.
hours on end, but
But we're out
we're
of
at our
time.
time, unfortunately. We didn't get to some of those points I think that you had written down, but I think this is a battle that's gonna be continuing to be had. I think, if you listen to that one episode I just did, I have a lot of personal feelings of why it's like that, but none of that kind of matters at this point. We need to figure out moving
Mhm.
forward, and we need to be, positive about that. We need to open our minds and figure out how things can be done and how they can just, if I think, as long as all of us have that same of what you have of, like, just protecting the public,
Mhm.
that's our job. So,
Yes.
if someone wanted to reach out to you, if they had any questions or want to give you some zingers to throw at me next time, how can they reach out to you?
It's erikaflateau@gmail.com, just like it's spelled in the show notes. And I also have a website, renewconsultingservices.com. But I love especially helping new grads. Like if they're like, what do I do with time management? Or can you give me a tip on this? If you want to just email me, I love to talk to hygienists and help them with some tips and tricks to make their day less stressful. They're my heart. So anyway, Andrew, it's so good to see you and talk to you. I really appreciate being on here today.
Yeah, thank you for being here.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.